What's up, everyone? Nurse Blake here. I am so excited because I am going to interview a corrections nurse. I do this quite often where I interview someone with a really cool, unique nursing job because I've only worked in the hospital setting. So I love to be able to showcase nurses that have really interesting jobs that are unique or different or jobs that we wouldn't ever expect. So if you guys have any questions about corrections nursing, make sure you put those down in the comments and I will ask Lindsey live what her thoughts are so she can answer your questions about corrections nursing. But before we get started, let me know where you guys are tuning in from, if you're a nurse, a nursing student, and what kind of nurse you are or what kind of nurse you want to be, because I may even interview one in the near future. But make sure you click that share button so your friends can know a little bit more about corrections nursing. And now I'm going to introduce you to our special guest, Lindsey. What's up, Lindsey?
Hi, how are you?
I'm doing good. How are you doing?
I'm great.
Thanks so much for joining me this evening.
No problem.
You
My
know,
pleasure.
looking back, I don't think I've ever known anyone who's been a corrections nurse, which is really cool to have you on. I have a lot of questions for you.
Okay, I'm ready.
I'm sure a lot of people have questions for you too. But just do like a little quick intro about your background in nursing, how long you've been a nurse, why nursing.
Okay. Well, I've actually been a nurse for a year, exactly a year. I've always wanted to be a nurse, like as long as I can remember. My mom was actually an intensive care nurse for like 30 plus years. And then when I was 18, my dad passed away from cancer. So I got to work or
Sorry.
like be around a lot of nurses a lot. So that made me even want to be a nurse even more. So I just kind of always wanted to be one, and I've always loved the medical field and watched medical TV shows like my whole life. So
Yeah,
kind
well,
of.
I'm glad you're in nursing. What was your first nursing job? You've been a nurse for a year. What was your
Yes.
first job?
My first job was actually at a transitional housing program for homeless veterans in Pittsburgh, Pennsylvania.
Okay.
Right out of school, and I kind of got their whole wellness program started. I was the only nurse there, so
Oh, cool.
they wanted
Awesome.
someone. They wanted a nurse to be there to like get the veterans into their health because the whole like holistic approach with everything and health to be part of it. So I got their wellness program started, and I loved it there. But unfortunately, I had already planned to move to Savannah, Georgia,
Okay.
so I had to leave the job, but I kind of had like the core started there so that another nurse could just come in and take over for me.
Okay.
It was a really great experience, though, especially since I'm a veteran myself. So,
Oh, yeah. I want you to kind of talk about that. So you were a veteran, and then you entered nursing.
yes, I joined the Navy when I was 18, and I wanted to be a corpsman in the Navy, but when I joined, they weren't taking any corpsmen at the time, so I went in as actually military police.
Okay.
And I did that for 5 years. And always in the back of my mind, I always knew I wanted to be a nurse still. So
Okay.
I ended up getting out of the military and using my GI Bill to go to nursing school. So it
Well,
worked
that's
out pretty
awesome.
good.
Thanks for your service. And I'm so happy you're a nurse. So you went from the wellness job to a corrections nurse. So kind of explain why corrections. That was a bit of a change.
It really is. So when I moved here, I went on Indeed, the job search, and the job was open. And since I was military police in the Navy, I thought it would be really interesting to kind of bring both of my passions into one as
Okay.
a police officer and a nurse. So I applied for the job and ended up getting it like really quick. So, and I just thought it would be great, dealing with people that are going through some of the hardest times of their lives
Right.
to kind of just everyone is taken care of. So just kind of
Yeah.
to brighten them up if you can.
Yeah.
Brighten their
That's
mood.
awesome. So I want to know, like, what hours do you work?
I work 7 p.m. to 7 a.m.
Okay, so 12-hour shifts.
Yes.
And what does a regular shift look like?
So when I get to work, I work in the infirmary. So there's
Okay.
day shift nurses who work in each unit and do the med pass for everybody and just, do the med pass and anything that has to do for the inmates on the unit. And then there's the infirmary, which is kind of looks like a hospital
Okay.
unit in a way. It's just where all of the really like sick inmates are. So that's where I work, and I work night shift there. So at night, there's only 4 nurses in the entire building and no doctors.
Okay. Well, geez,
So
so it's just you guys.
yes,
Oh, wow.
I'll
Okay.
get to work and we'll do shift report, and then I do med pass to all
Okay.
of the patients in the infirmary. And after that, basically, we just monitor everyone all night and we respond to signals, which I can explain what signals are if you want.
Yeah, do it. What's a signal?
Okay. So they'll call over the radio, the officers will call a signal 55, and
Okay.
they'll say, signal 55, chest pains. And either
Okay.
me or the other nurse I'm working with have to go to whatever unit it's on. It's
So
going to
it's
be
kind of
really
like a
scary.
code in the hospital, like a rapid response or a code blue.
Yes.
Okay.
And so we get there, we assess them, we decide if we need to call the on-call doctor or if they have to get sent to the hospital, basically.
Okay.
So sometimes there's only one a night, and sometimes there's like 10. So it just
Wow.
depends.
So in the infirmary, how many patients are you guys taking care of?
Usually about 15 to 22,
Okay.
and there's 2 nurses. So
And then on top of that, you have your signals or your codes you guys respond to.
yes.
So your ratio is about what, 4 or 5 patients per nurse? Is that what it kind of breaks?
Basically, yeah. I mean, there's only 2 nurses in the infirmary, and the other
Okay.
2 nurses are actually in intake. So they're
Oh, so you
kinda,
have like me have 12 patients.
yes.
Oh, so you're busy.
hmm
Wow,
And
that's a
our
lot.
our patients usually are half mental health and half medical.
Okay.
Yeah. So
We got a question from Joan. Are you ever concerned about safety?
I actually only once so far I've actually gotten scared. So
Okay.
anytime we have to go into a patient's room, we're with an officer.
Okay.
So that's really comforting. Like we cannot go in there without an officer with us. So
Okay.
they make us feel really safe all the time.
Well,
So I'm
that's
actually
good.
it's not as scary as you would think.
Are there any officers that are full-time like in the infirmary?
Yes, I work with the same 2 every night.
Oh, oh, that's nice.
Yeah,
Oh,
yeah.
I love that. And you're 3 days a week?
It's actually like a swing shift. So like I'm about to work this whole weekend, Friday, Saturday, and Sunday, and then I'll be off Monday, Tuesday, and then I'll work Wednesday, Thursday, and then be off Friday, Saturday, Sunday. So for me, I have like an automatic 8 hours overtime on my paycheck.
Oh, that's nice.
Yeah, it's
She
pretty cool. I
got
love
that
the
extra
schedule.
I love that. Those of you tuning in, I'm Nurse Blake. I have a special guest, Lindsey. She's a corrections nurse, and I'm just asking her questions because I'm so intrigued about this job. And if you guys have any questions, make sure you put them in the comments. We have a question from Jocelyn. She said, any advice for going into correctional nursing as a new registered nurse?
As far as advice, I would just say go into it with an open mind and leave all of your judgments at the door. Just, like any other nursing job, just go in and, look at them as just any other patient, just a sick person and going through a hard time. And, don't really think about what they could have done or why they're in there or anything like that. It's a really good experience working as a corrections nurse. You get all types of experience. And like I said, just, leave your judgment at the door and try to enjoy it the best you can and learn from every minute.
That is so, so important because no matter what, they're people too. And they
Yes,
all deserve a nurse that doesn't have any judgments. And you don't have to just be a corrections nurse to care for those type of patients or inmates because we see it in the hospitals all the time.
exactly,
And we're
exactly.
caring for inmates and they're patients to us. And we can't, like you said, you can't really ask or care about why they're in there. They're a patient just like any other patient. So I love that sentiment you gave, which probably makes you a really awesome corrections nurse.
Thank you.
We got another question from Lisa. Do you know if nurses that work in corrections qualify for loan forgiveness from the state? Is it
Not
like
where
like a
not
government
where I work
position?
personally. I have heard of it with other. I think maybe at prisons they might do that, but not where I work personally. But
Okay.
I have heard of it being a
Okay.
thing before. Yeah.
Interesting. So it's something you would have to look into if you're questioning that. So you already answered my question. You work with 4 other nurses during night shift. but there's no other healthcare providers there. Do you have like doctors or nurse practitioners during the day?
Yes, during the day, a doctor or a nurse practitioner will come in and like assess all of our patients. But
Okay.
during the night, no, there's just
It's
nurses.
just you guys. It's just you guys. So, what is the hardest part about corrections nursing?
I would say for me, just how unpredictable my job is. Like I said, there's like half mental health, half medical,
Yeah.
and that plus the fact that we can't really go see any of our patients without an officer. So even if
Okay.
there's like an emergency going on, we still have to wait on them to go, do anything. But
Right.
they're really good about it. Like if I say, get over here now, like they'll come right away.
Yeah.
That's as far as like them actually being inmates, honestly, it's not as like intimidating as you would think. Because when somebody's
Okay.
sick, they're just like any other person. You know what I mean? So
Right. Yeah, that's an interesting perspective. I think even as someone who's not a corrections nurse, we have all these thoughts about what it is. So it's great to talk to you. So you can tell us what it really is like. Oh, we got a question from Cheri. Do you take care of OB patients?
yes, we do. Yep, we have a few pregnant patients. They're not
So,
always in the infirmary, but if
okay.
something's going on with their pregnancy, yes, they will be in there. So, like I said, a very big variety of
And
things.
this is something that I especially tell nursing students in school to have an open mind in all your classes, because you may think like, I want to go into cardiac ICU or I want to go into trauma. I'm not going to see any OB patients. I'm not going to see any pediatric patients. But as a nurse, no matter what unit you work at, no matter if you work in a corrections facility, you see it all.
Yes, you never know,
So you
seriously.
have to absorb all that information. It's so important. Keep your questions coming. We got more. Kelsey, do you think you will stay as a corrections nurse long term? What's your plan, Lindsey?
I think I'll stay there for a while. About to go back to school, actually. So being night shift and the schedule that I do have is perfect. So I'll definitely
Okay.
stay there for a few more years. I eventually want to work at the VA, so that's my eventual goal. But I definitely enjoy this job more than I thought I would. So I'll be there for a few more years,
That's
probably.
awesome. So you're an LPN right now. So you want to go
Yes,
back to school for what do you want to get?
I want to get my RN and then eventually my BSN. So
Oh, that's
definitely.
awesome. That's good stepping stones. I love that. We got another. These are great questions. Thank you guys for submitting your questions. What I love about this community is you guys are all so nice. We have like the best
exactly.
followers ever. I love it so much. So keep your questions coming. This is from Audra. Are your shifts typically busy, and do you have a lot of downtime?
It really depends on the night. Like sometimes it's very quiet, and like I
Okay.
said, I would have a lot of time to do schoolwork. And then
Yeah.
other nights, I'm literally running around the whole jowl the entire night, and it's a big jowl. So responding to different units.
You can't ever say the keyword.
Yeah,
It's
exactly.
like, don't say that word. You have to enjoy your downtime when you get it.
So you
That's so
really
fun.
never know.
Yeah. We got another question from Joan. What's up, Joan? How's it going? What are the biggest ailments you see?
Dealing with inmates, you see a lot of addiction.
Okay.
So we'll have a lot of people that are withdrawing from, drugs and alcohol. So that can be really scary. You really have to monitor that. And then we have some people that are older and they have like CHF or, you know, all kinds of stuff like that, diabetes, like the whole thing packaged together. So they'll have,
Yeah.
sole diagnosis and stuff like that. We have people on oxygen, and then we have some people there for the flu. So it just
Okay.
depends, but we do get a few serious patients. And then also we get all of the post-op inmates. So coming out of
Oh,
surgery from the hospital.
interesting. I would never thought of
Yes.
that. Okay.
So we have
Oh, that's so
post-op
interesting.
too. Yeah. So if someone just has cancer and they had
Yeah.
to get some kind of surgery for cancer, they'll be in there too. So
So do patients like what's the average length of stay in the infirmary? Can people be there for 20 days?
yes, we've had people in the infirmary their whole gel sentence,
Really?
honestly. Yes.
Wow. I'm learning so much. This is awesome. I'm learning so much. We have another question. Kay, are there certain types of equipment that you can't use? Whether that be like needles or sharp objects?
We can't use needles and, anything medical. We just have to be super careful about it.
Okay.
And we'll have the officer with us, backstepping us, making sure that we're picking up all of our stuff in case we forget. So, but
Right.
we use basically everything in the infirmary. They have if the inmate would have to go back to general population with a cane or something like that, it would have to be a wooden cane.
So interesting. I never
Yeah.
think about this stuff.
But
Lindsey,
as far
you're
as,
teaching me so much.
you're welcome.
I love it. This is awesome. To wrap up, what is the best part about being a corrections nurse?
For me, it's the experience. And like I said, some of these people are going through one of the hardest times of their life. So you can just tell by the look in their eyes that they're just miserable and depressed. And so I'll go in there and try and take care of them and try to make a joke or something like that. And just cheer them up as much as I possibly can and treat them like an actual human. Because, sometimes they're not treated like a human when they're in jail. So I just try to do the best I can to treat them good and treat them like any other person.
I love that, Lindsey. You're awesome. Thank you so much for coming on and providing us your insight. You are amazing. Keep up the good work, and you're really making a difference out there. So thank you, Nurse Lindsey.
You're welcome.
And good luck in school. Going back for your BSN, that's awesome.
Thank you. Bye, everyone.
Bye. Thank you guys so much for watching. I love having nurses on with different work backgrounds because the beauty of nursing is there's so many different opportunities and options for us, which I just love. So thank you guys so much for watching. Thanks for your questions. You guys are awesome. Have a great week. Have a good night, and I will talk to you guys later. Bye.